Welcome to this informative video about lamellar cataracts. Often described as a zone, or plaque-like opacity within the lens of the eye, lamellar cataracts are a unique type of congenital or developmental cataract. In this video, we will explore what causes lamellar cataracts, how they develop, their symptoms, how they're diagnosed and treated, and what the future holds for those affected by this condition. Join us as we delve into the complexities of lamellar cataracts and shed light on this fascinating aspect of eye health. The etiology of lamellar cataracts is multifaceted, involving both genetic and environmental factors. In many cases, they arise due to genetic mutations, particularly in genes responsible for lens protein production and development. These mutations can be inherited from parents or occur spontaneously. Environmental factors, such as exposure to certain drugs during pregnancy, maternal infections like rubella, nutritional deficiencies, or metabolic disorders in the infant, may also play a role in the formation of lamellar cataracts. Understanding the underlying cause is crucial for predicting progression and making informed treatment decisions. The pathophysiology of lamellar cataracts centers around disruptions in the normal development of the lens. During lens formation, specific zones of the lens develop at different stages. A lamellar cataract occurs when a disruption, either genetic or environmental, affects a specific layer of the developing lens. This disruption leads to the abnormal aggregation of lens proteins within that specific zone, creating the characteristic opacity. The location and density of this opacity affects the degree to which vision is impacted. The cataract is typically described as lying between the nucleus, the central part of the lens, and the capsule as the outer layer. Epidemiological data on lamellar cataracts is somewhat limited due to its relative rarity. However, it's understood that lamellar cataracts represent a significant proportion of congenital and developmental cataracts. The prevalence can vary depending on geographic location, genetic factors, and access to prenatal care and vaccination programs against diseases like rubella. While these cataracts can be present at birth, they may also develop during infancy or early childhood. Further research is needed to fully understand the global burden and distribution of lamellar cataracts. The signs and symptoms of lamellar cataracts vary depending on the size, density, and location of the opacity. Some individuals with small or subtle lamellar cataracts may experience no noticeable visual impairment, particularly if the opacity is located away from the visual axis. Larger or denser cataracts, however, can cause blurry vision, glare, halo surround lights, and reduced visual acuity, especially in bright light. In children, lamellar cataracts can lead to amblyopia, or lazy eye, if not detected and treated early, as the brain learns to favor the eye with clearer vision. Parents might notice a white or grayish discoloration in the pupil, although this is less common than with other types of cataracts. Diagnosis of lamellar cataracts typically involves a comprehensive eye examination by an ophthalmologist. This includes a visual acuity test to measure how well the patient can see, a slit lamp examination to visualize lens in detail, and a dilated eye exam to assess the size, shape, and location of the cataract. In children, a cycloplegic refraction is performed to determine the refractive error, need for glasses, and rule out other causes of vision problems. Optical coherence tomography (OCT) can also be used to obtain detailed images of the lens and assess the cataract's structure and density. Lamellar cataracts can be classified based on their size, location, and density. Some common descriptions include central lamellar cataracts, peripheral lamellar cataracts, and complete lamellar cataracts. They are also categorized by their impact on vision as mild, moderate, or severe. The riders are another classification, which indicates that the lens is clear in between the nucleus and the lamellar opacity. This specific type is also known as the zonular cataract. This classification helps guide treatment decisions and provides a standardized way to describe the cataract's characteristics. Treatment and management of lamellar cataracts depend on the severity of the visual impairment and the patient's age. For mild cataracts that don't significantly affect vision, regular monitoring may be sufficient. If the cataract is causing significant visual problems, surgery is typically recommended. Cataract surgery involves removing the clouded lens and replacing it with an artificial intraocular lens (AOL). In children, special considerations apply, including the need for amblyopia therapy, a patching or eye drops after surgery to ensure proper visual development. Spectacles or contact lenses may also be necessary to correct any residual refractive error. In some cases, delaying surgery until the child is older may be considered to allow for more predictable refractive outcomes. While lamellar cataracts are often related to genetic factors, there are some preventive measures that can be taken to reduce the risk, especially in cases where environmental factors play a role. These include ensuring adequate prenatal care, vaccination against rubella, avoiding exposure to certain medications during pregnancy, and maintaining a healthy diet during pregnancy and infancy. Genetic counseling may be beneficial for families with a history of congenital cataracts to assess the risk of recurrence in future pregnancies. The prognosis for individuals with lamellar cataracts is generally good, especially with early diagnosis and appropriate treatment. Cataract surgery is highly effective in restoring clear vision. However, long-term visual outcomes depend on factors such as the presence of other eye conditions, the development of amblyopia in children, and the accuracy of IOL power calculation. Recent research is focusing on improving IOL designs and surgical techniques to minimize complications and optimize visual outcomes, particularly in children. Additionally, research is ongoing to identify the specific genes responsible for lamellar cataracts, which could lead to targeted therapies in the future.